Good afternoon, everyone. It is my pleasure to present our work to all of you. The topic I present today is machine learning approaches to review metabolic signatures of incident chronic kidney disease in individuals with prediabetes and type 2 diabetes. Today, I will mainly present our recent publication. In our study, we aim to identify and evaluate prospective metabolic biomarkers and the suitable set of predictors of incident chronic kidney disease in the pre and type 2 diabetes population. This is the workflow, and I will start with the cohort we use. Our Institute of Epidemiology is running the KORA cohort, which is a population-based study conducted in the area of Augsburg. 4 surveys with more than 18,000 participants have been conducted since 1984, with follow-ups for more than 30 years. In this study, we use F4 as baseline. The KORA samples have been quantified in US Metabolomics platform. Our study used the targeted analysis. In total, there were 125 targeted metabolites past the quality control and involved into the analysis. Before the formal analysis, I have adjusted the place effects with the place normalization factors. As shown in the figures, place normalization corrected the place effect in metabolite concentration. In this study, we used the combination of estimated glomerular filtration rates and urinary albumin to creatinine ratio to define chronic kidney disease. In our study, we used the KORA F4 data as baseline, KORA F4 as follow-up. After conducting the exclusion criteria, there were 385 hyperglycemia participants and 1,453 individuals with normal glucose tolerance involved into our longitudinal analysis. We used the hyperglycemia participants to identify candidate metabolic biomarkers and develop the set of predictors for incident chronic kidney disease. Let's come back to the workflow. During the procedure of selecting the candidate's biomarkers, because feature reduction is important for predictive modeling, I define a feature selection to select candidates biomarkers. I use logistic regression, priority lasso, and stepwise AIC selection to select the most strongly associated variables with incident chronic kidney disease. After the three-step feature selection, we identified 2 metabolites, single mullin C1821 and PCAA C3820 as candidates biomarkers of incident chronic kidney disease in hyperglycemic individuals. The significant risk effects of these 2 metabolites for incident chronic kidney disease were independent with 14 clinical variables, including eGFR and UACR. To strengthen our findings, I conducted several sensitivity analysis. One of the sensitivity analysis was I explored the interruption effect of candidate biomarkers with glucose levels for incident CKD. I found the risk effects of these 2 metabolites with incident CKD were significant only in the hyperglycemic subgroup, as well as in the top tertile of fasting and 2-hour glucose, respectively. These results indicate that the risk effects of 2 candidate biomarkers of incident chronic kidney disease are specific for hyperglycemia. In the next part of our study, I used machine learning approaches to develop and evaluate predictor sets of incident chronic kidney disease in hyperglycemic individuals. I performed cost validation comparing 3-step feature selection to select features. In order to assess the robustness of the predictive results, I applied 3 machine learning approaches to build predictive models. The feature selection and predictive model building were only conducted in the training data. The AUC values were only computed for the testing data. I compared the predictive performance of our developed predictor sets constructed with metabolites and clinical variables with the reference predictors in the testing data in each interruption. In total, I performed 100 repeats of 10-fold cross-validation, including 1,000 times of freestyle feature selection. The most frequently selected set of metabolites and clinical variables among these 1,000 selection rounds were defined as the best set of predictors for incident CKD in hyperglycemia. During 100 times of 10-fold cross-validation, when compared to the reference predictors, the median AUC values of our derived set of predictors consistently higher in all three machine learning algorithms in the testing data. These results suggest that our derived set of predictors outperform the established clinical predictors for incident chronic kidney disease. We further identified the best set of predictors for incident chronic kidney disease, which included 2 metabolites and 5 clinical variables. This set was the most frequently selected set over 1,000 selection rounds. Moreover, these 7 variables were the most important ones as they were the top 7 selected variables. Compared with the other studies, our results support evidence on single mullin accumulation in glomerular disease of genetic and non-genetic origin. In addition, we show the power of suitable combination of machine learning and classical statistical approaches to review normal biomarkers and improve the performance of classical clinical predictors of chronic kidney disease. As for the part of predictor selection and performance evaluation, one of the correct ways is to use cross-validation to select variables to avoid over-optimistic evaluation. But there will be another challenge, because when you apply cross-validation to select variables, there will be challenges for summarizing the candidate set of predictors, because each run of variable selection typically produces a different set of selected variables. So our study can provide some clues on how to summarize the suggested set of predictors in a correct cross-validation way, and how to avoid over-optimistic evaluation in internal validation. For more detail, please go to our publication. In summary, we identified 2 candidate metabolite biomarkers and the best set of predictors for incident chronic kidney disease that are specific for individuals with prediabetes and type 2 diabetes. It might potentially improve accurate detection of hyperglycemic individuals with enhanced risk for chronic kidney disease. Last but not least, I would like to thank all the co-authors, especially my colleague Marcela and my supervisor Wei Wang Settler and Anita Peters. Thank you for your attention.